Welcome to the inaugural Regional Rural Placement Webinar 2021. This is a joint effort between Deakin University, Deakin Rural Health, LaTrobe Rural Health School, Monash Rural Health, and the University of Melbourne Department of Rural Health, Going Rural Health. We've got quite a lot of attendees, so welcome. I'm glad you could join us, and we've got a lot of information for you and a lot of people to speak about the benefits of rural. So I'm Trish Thorpe. I'm the Going Rural Health program in Ballarat, and we're part of the University of Melbourne Department of Rural Health. So firstly, I'd like to start with an acknowledgement of country. So I'd like to acknowledge the traditional custodians of the lands that we are joining you from today. For me, that's the land of the Wadawurrung. I'd also like to pay my respects to the elders past, present and emerging, and acknowledge any Aboriginal and or Torres Strait Islander people joining us today. So why a joint effort with a rural webinar? So we're all part of the University Departments of Rural Health in Victoria. There are 4 in Victoria from the 4 universities who are participating today. We're actually all funded as part of a Commonwealth program that supports rural health education and research. And this particular aspect is regarding rural student placements, which is ultimately about rural workforce development. In terms of housekeeping, please stay on mute. If you've got any questions, please enter them in the Q&A. Panel members actually will only be visible to you when their video is on. And so when they're presenting, they'll turn their video on so you'll be able to see them. And for those of you who weren't aware, the session is being recorded and will be available to you after the webinar is complete. So what's considered rural? Basically anything outside Metro Melbourne and Geelong in Victoria is considered rural. Most of the time it's spoken about as regional, and you'll find that we'll use those terms interchangeably. And the towns in Victoria are actually classified by the modified Monash model, or MMM, and all but MMM1 is regional or rural. And you can actually see which towns in Victoria are classified as which MMM classification on that particular website. So why rural placements? Basically, it's about increasing the knowledge of rural health and rural health services. Now, regardless of whether you decide you want to work rurally or not, you will ultimately be working with rural people. So it's actually really important that you know a little bit about that. As I said, our program also helps with regional and rural workforce development. People that have a great experience in rural areas quite often will come and work rural, and we'll speak to some of those people today. Students who complete rural placements, as I said, will often practice rurally. That is probably something that happens quite regularly, though we haven't grabbed a lot of people. And a lot of people that are actually from rural areas will go and study in metro areas and then come back and work rurally as well. The other thing is that students actually report significant learning outcomes. There's quite a lot of different learnings that you get in rural areas, things that are a little bit, I suppose, more generalist, but I'll go into some of those things a bit later. And the other thing is civic awareness, learning a little bit about the area that, so actively being part of improving health outcomes for people living in rural areas. So promoting quality of life in the community. And there's quite a lot of research that actually backs a lot of this up. So the benefits of rural placements. Now, I could tell you all the wonderful reasons why I think that rural placements are fantastic, But instead, I'm going to give you the top 7 reasons that the students that completed our rural placement survey listed as to why they love their rural placements. And ultimately, number 1 is nearly always the support and time given to students. They quite often comment on how fantastic the supervisors are, how fantastic the people in the area are. So welcoming people and staff is also up there. The other thing is people quite often talk about the variety of patient presentations and the number of different conditions and different conditions that they're actually treating in a day. They also talk a lot about development of skills and confidence because the time that's being spent with them, and also there's a slightly slower pace, and quite often they actually have more time to consolidate their skills. A lot of people also talk about the rural lifestyle. I'm obviously going to be someone that will talk up a rural lifestyle because I think it's fantastic, but there are a number of benefits that the students will probably talk about as well. There's also a really good sense of community. So everybody pretty much knows everybody else in the smaller towns in particular, but there is a really good community feel. And lastly, a positive collaborative learning environment. You find that a lot of the different disciplines work together a little bit more than they do in some of the larger centres. And there's a lot of fantastic things happening. So why rural health? Why are we focusing on rural health? The Australian Institute of Health and Welfare has given us this particular quote. So on average, Australians living in rural and remote areas have shorter lives, higher levels of disease and injury, and poorer access to and use of health services compared with people living in metropolitan areas. Poorer health outcomes in rural and remote areas may be due to multiple factors, including lifestyle differences and a level of disadvantage related to education and employment opportunities, as well as access to health services. So quite a lot of this might relate to the social determinants of health, so things like income, education, housing, work status and type, social inclusion and exclusion, and access to social resources and health services. Talking about education, in the recent data, Metro stated that 75% of people finish year 12. In rural areas, this can be 50%. And this information is available online if you're interested in looking it up. So there are some challenges with rural health. Most people will be aware of some of them. The maldistribution of the health workforce between rural and remote and metro communities is pretty much why a lot of this is a priority for us. There are enough health professionals being trained. There's just not enough of them coming rurally, and that's obviously what this student placement program is all about. So as a result, there are sometimes rural workforce shortages, and a lot of the staff are part-time, so sometimes getting enough service for the region can be challenging. The other thing is distances travelled. Now, this can be by both staff and clients. So obviously clients might be a long way from their local health service and they might have to travel. But staff quite often will travel between multiple campuses of a health service. And so there's some of their time that could be clinical is actually spent travelling. The other thing that I probably don't need to tell anyone that's worked rurally is that some of the funding models that are set up don't translate particularly well to rural. As I said, some of the things like the travel, like the multiple campuses that you might find, it's not a one-size-fits-all model. A lot of us actually, I suppose a lot of people that have worked rurally will actually fight this with the Commonwealth, but the funding models are quite often just not enough for the services required. Access to services, especially specialist and mental health services. Most people would have heard from the Royal Commission on Mental Health about the deficit of services in rural areas. But also, a lot of the time, people having to see specialists will have to go to metro areas to access them because there aren't any available in their local area, or waiting lists are long. Rural areas tend to have an ageing population, so they have a higher proportion of older people, which obviously with the increased services required for them. And the prevalence of some conditions is actually increased in rural areas. So the prevalence of some cancers, cardiovascular disease and lung disease is actually increased in rural areas compared to metro. And there, as a result of all of this, there are some poorer health outcomes. So briefly, the 5 A's of access. In rural areas, are the services needed available? Are those that need them, can they afford them? Can those that need them actually access them? Do they accommodate the needs and of the users or locals? And again, this is what I was talking about, funding models, but sometimes just models in particular that might not be appropriate for the region where the services are. And are the services appropriate for those who need them? So, and some of these things are actually impacted because of the regions that people are in. So, for example, a healthy 45-year-old with a good income and means to travel may have more access to services than an 85-year-old with limited income or who can't drive. So the social determinants of health have a big impact as well. All right, so that's it from me for the moment. There's a whole lot of links there to some of our programs. Going Rural Health obviously is with the University of Melbourne. We've got a specific website, we've got email, Facebook, Twitter, a newsletter and a blog. So if you're interested, check out our website. All right, so now I'd actually like to introduce Mark Woodfield, who's from Monash Rural Health, and he's going to talk a little about rural placement information and support. Thanks, Mark.
Thanks, Trish. Yeah, so the Monash Rural, if you can just jump to the next page. I guess the question is, a lot of people ask us is, what sort of support is available to students as they go on placement in a rural area? And I guess the major thing that we find, which supports what Trish was saying around the welcoming staff, is that students find the pastoral care support is pretty strong, and they appreciate that especially if it's a first time out of home, that extra care and attention they can get is often welcome. Within that, though, especially at the bigger sites, whether I guess it'd be Ballarat, but certainly within Monash, you've got Bendigo and Mildura, and then out in Gippsland with Tarralgon and etc. Social events that are held within the student cohorts. So there might be a barbecue or some sort of gathering of students who are on placement at that particular time. So it's a good opportunity to catch up with students probably from other disciplines. That could be medicine, could be physio, could be any number of disciplines that are on placement at one time. So being able to socialise and meet people with similar interests in their study. Going along with that is the opportunity for networking as you're on placement, and you'll get to know, in a rural setting particularly, your supervisors pretty well. You get much closer contact with patients than you often do in a city environment. So yeah, so this networking of getting some names and references from people who have gone through the process of getting qualified is seen as high value. Some of our sites run some workshops of collaborative care, so specifically around, they might be clinical simulations, those sorts of things. where the different disciplines get together and work through case scenarios. In addition to that, there's help with on the financial side of things, which could either be through subsidised accommodation, and that varies depending on which university's area that you go into, and we'll talk about that in a tick, or they might be in the form of financial bursaries. Our Wave is the rural workforce agency who in Victoria, they and some other organisations have grants available to help with disbursements along the way. Next slide, please. So in Victoria, this is a quick map of the way it's been divided up, or how the universities look after students in their patch. The only complicating factor here is LaTrobe, because that's got a few locations which cross over where Monash and Melbourne have programs running. So that's the little dots up in Mildura or in Bendigo or in Shep or up in Wodonga. So you can see how the state is divided. So there, for example, if you're going to Warrnambool, you'd be looking up Deakin's offerings in student support. Next slide, please. Yeah, so these are just some links to the different rural health departments from the collaboration that we have. So if you've got a QR code, you'll be able to scan that or type the URL, and that'll take you straight to the site or the university that's looking after the area that you're going to. I think that's it from me. I'll hand over to Georgia and Rhiannon, who are also colleagues of mine from Rural Health, who are going to talk to you about placement accommodation.
Yep. Could we please have the next slide? I'm going to talk about a couple of the sites, obviously our one. So we can host students in a sense at Bairnsdale, Bendigo, Castlemaine, Foster, lots of places. You can see them all listed there, but generally all the way in Gippsland, South Gippsland, Mildura, Bendigo, as I mentioned. So we have subsidised accommodation, and it's $10 per night with a 2-week minimum booking. So it's available for all Monash students and non-Monash domestic students studying at other universities. There are some exceptions and things like that, but one of them is that paid intern placements don't qualify.
Yeah, so we don't have, so paid internships do not qualify because we do have specific funding from the rural health schools. Just with paid internships, we've got a lot of hoops we have to jump through. Doesn't quite work with our funding. So to be able to give that heavily discounted accommodation throughout our Monash Rural Health accommodation, we've just got to have a couple little things. So you can see at the bottom is a few pictures of our accommodation throughout our site. So as you can see, we've got quite a few sites at the top there, ranging from Bendigo through to Wonthaggi, Sale, everywhere through Gippsland, and up to Mildura as well. So we have quite a few areas that we can offer accommodation, and we're always looking to spread that. So I'm hoping to get some more in Swan Hill. So we're all sort of hoping to keep going and bring accommodation. Did you want to keep going, Rhi?
Yeah, sorry about that. I have some small 4-legged people at my house. So LaTrobe University has Albury, Wodonga, Ballarat, Mildura, Shepparton and Bendigo, and their website, George has kindly popped in the chat as well if you wanted to grab that along with ours. Their costs, it sort of depends on location, the type of accommodation you get and the duration. And as you can see, they've kindly popped in some pictures for you to give a little bit of an idea about what some of it looks like. Next slide. And thank you, Georgia.
Cool. So I'll take over from here. So we've got University of Melbourne Rural Health. So they also have some really beautiful areas to stay where LaTrobe and Monash don't. Ballarat, Creswick, Shepparton, Mount Beauty, Numurkah. So all those little areas actually that can be quite hard to find other accommodation that aren't quite near main cities. So that's really good. to have them. So all their sites are equipped with EduRoam, same with Monash University are all equipped with EduRoam, same with LaTrobe as well. They have fully furnished houses, townhouses, bedrooms, dorm style living. So similar to Monash as well, and LaTrobe all have different sort of styles of housing depending where you're staying. Their costs are really, really good. So they do have an eligible subsidization instead of a financial assistance. So they have up to $50 a week for that. And then otherwise it's $200 a week. So obviously you can just check their website to see if you're eligible for the subsidized rate. Next slide, I think we have Deakin. So Deakin University, again, fully furnished housing, 3, 4, 10, 12 bedroom houses. Pretty much everywhere has access to communal kitchens, bathrooms, living areas, laundry facilities, all free to use with the laundry facilities. They've got some Deakin's really good because they like to be close to their hospitals. Depending where you might stay, it might not be within walking distance of hospitals. Generally, we try to keep it within walking distance, but you can never be sure where you can get. So their cost varies from, it can be free in some of the smaller towns, which is really good, but then up to a maximum of $120 a week. So obviously really affordable as well there. So they're quite good. And then I think the next slide, we've just got the rural health. Sorry, no, yeah, we've just got, so the health services accommodation, so not affiliated with the UDRH universities, but a lot of the hospitals have their own student accommodation. So generally you can contact the hospital. I know here in Bendigo and in Castlemaine, a small town about 30 minutes out of Bendigo, all have student accommodation, all fairly affordable, not quite as affordable as the universities, but they have limited amounts of student accommodation available, generally all fully furnished. All you really need to bring is a blanket and a pillow. Yeah, so that's about all for accommodations. If anyone had any questions, feel free to pop it in the chat. But yeah, so Ree's put the links in so where you can go to apply. Generally applying is through, most of us have StarRes, which is one of the new websites. It's a bit of a application process, and then generally, I know in Monash University, we like payments up front. So if you're saying from 2 weeks up to 3 months, we generally like payments up front. But other unis, I'm not quite sure, they may do it differently. They may have a monthly invoice system or something like that. But generally we're all pretty good. If you have quite a lump sum to pay up front, if you let us know, then we can usually work out arrangements, that sort of thing. But just remembering that there is lots and lots of scholarships and things available to help you out with paying for costs of accommodations. Thanks, Trish.
Thanks, ladies. All right, so we're going to move on now to the student and new graduate panel. So I'm going to introduce Rebecca Crossling, who's from LaTrobe Rural Health School. Thanks, Beck.
Thanks, Trish. I'm Beck. I'm from the Rural Health School based up here in sunny Mildura, Latchi country. So welcome online, everyone, today. I can see some of our students and our grads are turning their cameras on. So I've got Margaret, Stephen, Hannah, Crystal is there, I can see, and Ginny. Fantastic. So we've got some coming on, so that's fantastic. We're actually moved through at an earlier pace than we planned. So I'm assuming some will come on as they do as well. So we might just start by kicking off, and I'll just give you a rundown of how I see this working. Is basically we really want our attendees to have time to get their questions answered. So please do put questions in the Q&A box, and we will make sure we ask it to our grads and our students here. But also if any of our panelists here want to just add something to something else someone said, please just put your hand up and unmic and feel free to add in, because that sort of conversation is what works well. So to start off with, I might just get yourselves to introduce yourselves. So if you could just introduce yourself, tell us your name, where you grew up, what you studied or you're studying, and which university you're from, and what regional areas you've undertaken placement in. So I will just call on Margaret first.
Yeah, awesome. Thank you for that, Beck. So, hey everyone, I'm Margaret and I grew up in Melbourne. I am currently in my 5th year, so final year of dentistry at LaTrobe University. So I've just come back from placement, so I'm in my placement uniform. And I'm actually in Mildura right now doing placement. So I did 3 years in Bendigo, 3 years of uni in Bendigo and a bit of placement there. Then I did placement for a year in Wodonga, Albury-Wodonga last year, and now in Mildura. Awesome. Pass it back to you, Beck.
Thanks, Margaret. Stephen, we'll pass over to you now. Thanks.
Sorry, if there's background noise, I'm just driving back from Finley right now. I'm on placement currently. Can you hear me?
Yes, we can hear you. Go for it.
Oh, okay, cool. My name's Stephen. I'm a 4th year physiotherapy student from Australian Catholic University. I grew up in Bendigo, but I qualified as an OT and I've worked as an OT in Melbourne, Canberra, through regional Victoria, and I started my physio study in Adelaide, so I lived over there for a bit and transferred across to Victoria. I'm in my final year and I've done a couple of placements in Shepparton and I'm currently in Cobram, but part of the Cobram placement requires me to go up into the south of New South Wales, of regional New South Wales.
Thanks, Stephen. We'll pass over to you now, Hannah.
No worries. Hi everyone, I'm Hannah. I am from Bendigo. I live in Bendigo and I've grown up in Bendigo. I am a qualified occupational therapist. This is my first year out since being at uni for 4 years at LaTrobe in Bendigo. I did 4 years of uni at LaTrobe Bendigo. I did a Bachelor of Applied Sciences and then the Masters in Occupational Therapy. And my placement experiences, I did a very rural placement through East Wimmera Health Services, which is places like Donald and Wycheproof and St Arnaud. And then I also did placements in Bendigo at Bendigo Health, which is now where I'm working.
Thanks very much, Hannah. And I'll just ask George to introduce yourself. I've seen, George, you've just joined. If you could just tell us your name, where you grew up, what you studied, which university you're from, and what regional areas you've been on placement in.
No worries. So my name's George. I grew up in Melbourne, inner city Melbourne pretty much, and Thornbury. I'm studying a Doctor of Clinical Psychology at Deakin University, and I'm currently in Camperdown, which is about 2.5 hours west of Melbourne, down near sort of Warrnambool.
Thanks very much. I'm just going to throw to Ginny now because I know Ginny's a bit worried about her phone battery. She's actually over in Narracourt in South Australia at the moment. So I'll throw to you, Ginny.
Thanks, Beck. So I'm quite rural at the moment. I've come to Narracourt because we've got a new addition to the family, and I literally just text Beck. I'm like, I'm so sorry. My phone's dying. I have no service. So my background is I actually grew up, I'm from New Zealand. I grew up in Narracourt, which is a very small town in South Australia. I moved to Brisbane, and straight from Brisbane, I went to Mildura, and it was Mildura that I actually decided to study nursing. So I've just finished my registered nursing degree, and I'm about to start my grad year at the Mildura-based hospital. I did my placements predominantly at Mildura, at the hospital there and in the community there, but I also did a placement at the Royal Children's Hospital in Melbourne.
Thanks, Ginny. And lastly, we'll go to you, Crystal, to introduce yourself.
Hi everyone, my name's Crystal. I'm a new graduate doctor. And I did an undergrad degree in biomedical science at Monash and a postgraduate degree with Monash again, which started in Churchill and sort of got me really interested in rural medicine because I grew up in Melbourne, quite close to the city, didn't really have much experience with it. And after Churchill, I ended up staying for Warragul, Leongatha, Wonthaggi, Traralgon, and now I'm out in Bairnsdale and Lakes Entrance. So I'm kind of doing a tour of East Gippsland at the moment.
Great, thank you so much. All right, so I'm going to throw some questions to you, and I might just say to our panelists, to our attendees, as I said, we will prioritise your questions. So I can see we've got one coming in now. But firstly, I'm just going to ask George a couple of questions because I know George has to leave early. So I'll just throw a few ones to him just so he can share his experience. But as you said, George, you're from Melbourne originally and undertaking placement in regional Victoria at the moment. Can you just share a little bit about what has surprised you about your regional placement experience?
Yeah, sure. Look, probably the first thing is just like the amount of autonomy that you sort of get at a rural placement. So I guess I had a bit of an idea of that, but yeah, it didn't really hit me until I actually, turned up in Camperdown, and pretty much from day one, it was straight into it. And just doing a whole bunch of different sorts of things, like working within different teams, and just, yeah, a lot of freedom to kind of try things out, and just really deep learning. So that was probably the biggest surprise for me.
No worries. And you've undertaken placements, I think you said metropolitanly and regionally. Is there something that struck you as a difference, or something you can share today that with our students that might not have gone on placement, how the experiences were different?
Yeah, sure. So I've done one placement, a full placement in Melbourne, so at Eastern Health. And then my next placement after that was in Geelong. So, I don't know if that's classified as regional, but, it's still in a pretty big city. I guess the main differences I've seen between Melbourne and Camperdown is, as I said, with the surprises, like just the amount of autonomy you kind of get. Whereas my first placement, there was a lot of supervision. You're not really seeing clients by yourself, kind of thing. Whereas in Camperdown, like I said, you kind of just straight into it. The supervision's there if you need it, but you can really be just left to your own devices if you kind of feel confident doing that, which is obviously a little bit uncomfortable at first, but really good learning. Probably as well, in terms of rural context, you just notice how some areas are really, really underserviced, and obviously this can be a problem in metropolitan context as well. But just the difficulties with access and that sort of thing, that's really kind of driven home when you're actually here and trying to help clients or help patients, and just seeing how difficult it is to access different services, especially when they might be living 2 hours out of the closest town or something like that.
Okay, thank you. So I'm just going to throw to Crystal now, because she's just messaged to say she'll have to log off shortly. Oh, great, she's there. So I thought I'd just get a couple of answers from you, Crystal, before you have to go. But you talked about, so you're currently practicing in Bairnsdale and have undertaken placement all over the state by the sounds. So obviously the experience has lured you to work rurally. Can you share about what about the experience has lured you back there? Or shouldn't say or to there.
So medicine, quite like allied health, I think this has been touched on quite a bit as well. It's about the teamwork really, and how the teams work, and how you work with not just your own colleagues in the same field, so physiotherapists or nurses with nurses. It really is about how we work together for the patient care. And I think I've been in metropolitan hospitals as well. I've done Sandringham, I've done the Alfred, I've done all of this. And I think seeing all of it really showed me the best patient care usually happened in a smaller setting, in a rural setting, even though we have less resources, simply because we communicate a lot better. If we have a problem, we can just go find the allied health member. We can just talk to them and say, hey, this is what these are our goals for the patient. What are your goals for the patient? How do we achieve this together? For example, if a patient has just had a total knee replacement, we're obviously concerned about the knee and what's going on there, but we can't do anything without physiotherapy coming in and helping that patient to get back on their feet. So it really is about the work we do in between teams. And rurally, I found that for every single person I've talked to, every field I've seen, you just get more experience as a student, you get more respect as a student. You're not just an extra baggage like you are on some teams. You have a role, you have a purpose. And I think you get something very different, very unique. Every hospital is different too. Some are better at some things than others. So trying a lot of different things too, and it doesn't bind you in, it doesn't sort of force you to come that way. I think it just sort of happens where you do fall in love with them and you're like, oh, you know what, I'm going to stay. And I think it's a good thing. It's good to put yourself out there. It's good to actually say yes to those opportunities, because you can just do the standard, stay in Melbourne, do the training there. Obviously, there are more jobs in Melbourne. Obviously, it can be, in terms of future prospects, there are some things that might draw you there. But I think if you don't try other things, if you don't actually open yourself to the new challenges, and there are challenges working rurally, a lot of challenges working rurally. If you don't open yourself to that and say, yes, I want to try that, I think you miss out. I think you really do. So it definitely is worth at least once giving it a go. And, you never know, you might actually absolutely love it.
Thanks for that. And just while I've got you still, I really would love, before we go to some of the questions, for you to share a little bit about immersing yourself in the community whilst you were on placement, because the medical placements are so long. I imagine there's a bit of that you have to experience. So what are the kinds of things you did while you were living in some of those communities? Was it sport, socially, just to kind of really get a feel for what it's like to live and work rurally?
Yeah, so for me, I love being outdoors, love doing lots of things. So it was amazing, actually, because I did a year in Warragul. I did, I think, 6 months in Teralgi and Wonthaggi sort of area. And like the best part for me was getting out there and actually exploring the area. So like in terms of the actual activities you can do so much. You're so close to everything. Some of the most beautiful places in the country, if not the world. Very unique ecosystems and things. So definitely worth getting out there. But also getting involved with the community. There's so many sports. We played heaps of netball, heaps of soccer, cricket, and that was community stuff. It wasn't necessarily through the university, though you could, of course, do it through them. It was usually more fun to do it in the community. And if you got like other friends here, there's so many things to do. There's so many events on the farmers markets. You end up getting to know people as well at these sort of things, and they know exactly what you're buying, so that you can even ask them to keep stuff for you. You form this personal relationship with people at the stores and people at, even places you go really regularly for walks. You see the same people over and over again, and it really feels like a community that everyone there. The longer you're there, obviously, the more you know. So it definitely is a very different experience to Melbourne.
Excellent, thank you. All right, I'm going to start throwing to some of these questions. So I've got Stephen and Hannah here, who are OT and physio students. One of our first questions here is question to some of the allied health. How well supported did you feel while undertaking your rural placements academically and pastorally? Did you want to attack that one first, Stephen?
So support. I feel.
Well, Stephen, we might have to just.
I've done.
Stephen, sorry, I just have to interrupt you because I think you're cutting out a bit. All right, we might just go to Hannah, if that's okay. Hannah?
Fine, that's okay. In terms of how well supported with the rural placement academically, because it was a slower paced placement when I went on the rural placement for my first big 4-week placement, my placement supervisors gave me more of an opportunity if I wanted to look up something or I wasn't confident with an area that I hadn't heard of before, I hadn't had much experience in, that I had allocated time within the placement hours to look that up and to ask for help or to go through it with them. So I felt very supported academically, but I did also have wonderful supervisors who were encouraging me to spend that extra time feeling confident on an area whilst in my placement hours rather than going home. So that I was confident going into seeing the patient with a particular type of condition or with a new type of intervention or assessment that I wasn't known to me, if that makes sense.
Absolutely. Stephen, did you want to have another crack? I think you were cutting out there for a minute.
Yeah, I'll have a go. I'm in a section that's not great reception.
Oh, that's okay. Still a bit crack. Oh no, keep going.
Yeah, I felt like I've had plenty of support. I've been pretty busy. My first block was a bit slower, so I had time to really research conditions, it was quite complex presentations. And then the second block, because I did half a day on inpatient surgical and outpatient surgical in the afternoons. And then in this one's been private practice. I've had heaps of support, but at the same time, I've had to spend, just because of the sheer busyness, especially with the private practice, being in rural, I've got a lot more responsibility, so less time during the day. So I've had to spend my evenings doing a bit of research and a bit of study and get on top of things so I'm ready for the next day. But I've definitely had the support when I've needed it, and all my supervisors have catered to how I learn best and have asked me about what's the best way you learn. Do you like having someone in the room? Do you like having someone just sort of nearby you can turn to so you're not feeling like it's an examination of yourself? So I feel like I've had an adequate amount of support and people have catered to it.
Excellent. Thank you for that. All right. So now our next question is, do I need to be more self-directed in my learning in rural placements? Is there anyone that wanted to unmute to tackle that one? Maybe Margaret or Ginny that haven't had a chance to talk yet?
I can.
Go for it, Gin.
So the one thing that I found with my placements that I did was it was actually totally up to me if I wanted to be self-directed or if I wanted more support. So as much as like I agreed with what Hannah and Steve and I think Crystal, I agree what everyone said. You know, you've got more opportunity to go out and do things and learn things and be unsupervised. But if you're not comfortable with that, all you have to do is say, look, I'm not comfortable with that, and then they will totally come and support you. If that answers the question.
Absolutely. And what about you, Margaret? Is anyone else here wanting to answer that around, I forgot what the question was now. It was around self-directed learning.
Yeah. All right. I'll add on to that. What Ginny was saying is similar to me as well, in that if I ever don't feel comfortable with doing anything, then they will jump in and help out. But I found that, yes, there is quite a lot more self-directed learning, because now you're jumping into the real placement side of things. So then you're going to see patients, you're going to be seeing things that aren't just textbook. So you might need to do some of your own research or go out and ask your demonstrators, ask your teachers, so that you can get a bit of extra help. So I think rural placements, the great thing is that it's up to you how much you want to learn and how much you want to put in. So I find with these things, it's always whatever you put in, you get out of that. And because uni study, for me anyways, it's on top of placement as well. So it does mean that I have to drive that learning because it's a lot of online stuff. So I do have to put in that effort. So yeah, it might be a bit more self-directed in that sense.
I'll add on also, just from also experience as a clinician in the past. Obviously, like, so for physio, you're typically doing most of your placement in the final year. So you're less than 12 months. So you'll get the support, you'll get some guidance about what you need to work on, maybe what you need to, in terms of your knowledge base or skill sets. But at the same time, you're 12 months away from being your own clinician with a little bit with support as well. So I personally feel like there's an expectation on myself to have to direct my own learning, that I have to identify, know what my weaknesses and what my limits are, not just to rely on the supervisor. So I think self-directed learning is big. I'd say it's big in any placement, but I think, yeah, especially in the rural, because of the increased autonomy you tend to have compared to a metropolitan placement, and the fact that you might be seeing issues that you are a bit more, I guess, transdisciplinary, so sort of start to bleed into other professions scopes slightly, purely because you might be in a small town, you're literally like a physio and a GP only, and it might be that you might have to pick up some skills of an OT a little bit if the nearest OT is 2-3 hours away, or at least have an understanding of what they can offer, so you know when to refer a bit more. Whereas at the hospitals, you know, or in a metro placement, it's pretty easy. It's like, oh, well, a specialist is like around the corner or in a couple of suburbs away. Not necessarily the case when you're on rural placement. So
cool. Thanks, Stephen. I will just welcome Maddie, who's just joined us online here. And Maddie is working as a social worker. And the next question I want to ask is around the main challenges of working rurally. So just before I direct that to you, Maddie, if you could just introduce yourself, tell us where you grew up, what you studied, what uni you were at, and when you were at uni, which regional areas you went on placement in.
Sure thing. Good evening, everyone. So my name's Maddie. I grew up in Melbourne and I'm currently working and living in Ballarat. So I recently graduated from the Master of Social Work at Melbourne Uni. And for my final placement, I decided to go regional and I went up to Shepparton and was placed at the Goulburn Valley Pregnancy and Family Support Service. I think I've covered everything.
Yeah, absolutely. So we'll just I'll get you to answer this question while you're hot on, is what do you say are some of the main challenges of working rurally? And we might move to you, Hannah, after that, just because you are working as well as a new grad. Go for it. Maddie, kick off.
So, I mean, there are probably just as many challenges as there are benefits, I guess, to working regionally. I think some of the challenges might be around access to resources, access to sort of a broad multidisciplinary team that you might have in Metro, but not so much in regional, or perhaps they might be harder to find. And you have to sort of really reach out to your community and develop those connections to realise the strengths and resources that are within communities. It might not be so easily visible, I guess. One of the other challenges, I guess, would be funding around services, what is possible, given how programs are structured and funded. Although I'm quite lucky, I work at Ballarat Health Services, so it's the hospital here. So we're really quite well funded. So that hasn't been a difficulty that I've personally come across, but I know from colleagues working in other services that absolutely can be. I think that's probably it for me in terms of challenges. I think I've only really been working full time in this role for about 3 months. I'm still getting my head around it, but I'm sure more will come to light as time goes on.
No worries. Might throw to you, Hannah, if there's anything you wanted to add there now that you're working in Bendigo as an OT.
I suppose my challenges were more for my rural placement, probably not for my placement and now my work, as I'm working at my hometown, so I feel well connected and I feel well supported. But when I did my rural placement in 3rd year of OT, I found probably one of the main challenges was the time travelled, because it was quite a lot of distance from where I was staying to many of the locations, because it was a multidisciplinary team that also had different locations spread around different areas that were 2 hours apart, in some areas an hour apart. So I feel like my biggest challenge was the fatigue that brought on, because it was early days and late finishes, and just a lot of travel that was hard work, and sometimes, especially when you're trying to work on the weekends and things like that. So I was probably managing that was my biggest challenge.
And okay, no worries. So we'll move on to another question here that's come in through our attendees, and it's probably one any one of you can answer, as you've all been on placements. How did you handle maintaining relationships with families, friends, partner during rural placements, where obviously some of you would have been away from home? So is there anyone that wanted to tackle that one?
I guess like online makes it easier. So I'm constantly talking to friends and family throughout the week. And I'm fortunate enough that my family is actually based in Bendigo, so they're very central in Victoria. So wherever I go, I'm not only like maybe a few hours away from family, but most of my friends are in Melbourne. And like the thing you realize when you go on a rural placement, and if you've lived regionally before, is you realize that like traveling 2 hours to see someone's literally nothing. Like but don't bat an eye at 2 hours. So if you have to drive back from say Cobram to Melbourne's like 2.5, I think, which now initially it sounds like a lot of time, but now you're like, oh, you know, I've got a full weekend. Maybe I just plan to go back to Melbourne and see family for a weekend regularly as well. That's how I've found it. That yeah, traveling that distance is hasn't been too much of a problem for me personally. That's been but because everything's a little further when you're in a rural area, your perception of how of time changes. So something that's 30 minutes down the road is and it's a whole different town is actually not even that far. It's a blip of your day.
Yeah. And is there anything else anyone wanted to add there about maintaining relationships? I can see Margaret.
Yeah, I'll add on to what Stephen was saying. So for me, I'm in Mildura at the moment, which is around 7 hours drive from Melbourne. So it's quite far. And in Wodonga last year was about 4 hours drive as well from Melbourne. So to keep in touch with friends and family, like you said, online really helps. So I just made sure that I was still calling parents, family, and friends every now and then. I was quite busy with placement, so I didn't have heaps of time, but it was just like the weekends when I had some downtime, just making sure you're still putting in that effort to maintain those relationships. And what he was saying too, like when I was in Bendigo, 2 hours travel for the weekend was nothing, and now even 7 hours driving is not nothing, but it's not bad. If there's something in Melbourne, then I will make that drive to do it.
No worries. Now I just might go for our next question. I'm going to go, it's about COVID and whether COVID negatively impacted your placement. So I'm just going to throw to you, Ginny, just because I know last year was your final year of nursing. So did COVID affect your placements at all?
It wasn't. Yes and no. So with some students, it did affect their placements, especially when they were in the midst of, I'm so sorry, my puppy's just got out. Hold on. Come here.
That's okay. You can go for it.
That's okay. Yeah, so I know for the first group of students with their placements, it did affect them. They were taken from emergency and ICU and put onto the wards. But by the time I got to my placements during COVID, I was actually still able to attend my emergency and my theatre placement. So I was quite lucky that way. It was more so in emergency, there was a section of our of the emergency department that was actually shut off. So students actually couldn't go on that side because of COVID. So we weren't actually able to see if there were any like real traumas that came in, and they actually went to that side because that's where the trauma rooms were. We actually weren't allowed to go over there because that was also like the COVID section. So that's where it did really affect it. But overall, it was more so attending our clinical classes that affected me, because we weren't able to attend campus. We had to rely on our placements to be able to get those skills. So I was really like pushing and quite self-directed. I was actually asking a lot of my preceptors, this is my last placement or this is my last year, and I really need to get those skills because, you know, I'm not getting them during these clinical labs that I'm supposed to be having. So I really drove that myself, and I got great support from my preceptors. They were really understanding, and I just stressed to them, you know, there's a transition from student to then being a registered nurse, and you're on your own. So that's why I really drove that as well.
I'll just put that to anyone else there. If anyone else had anything negative that happened to them because of COVID whilst on placement, like Ginny's already talked a bit about, not just it affected them, but also like while you're on placement was a bit different. And I know, George, you've got to head off soon. If there's anything you glaringly want to add, please feel free to unmute and add in.
Yeah, it wasn't a whole lot, to be honest. Like, I was really lucky in Camperdown. We just had to wear masks basically in sessions with clients, and masks in the office for a bit. So, I mean, yeah, it's been a lot better than my previous placement, which was all telehealth, and I couldn't actually see people face to face.
No worries. And whilst I've got you, and this is quite unique to you, you've gotten around during your placements, you've gone to Vietnam, and you're heading off soon to Alice Springs. Can you share just a little bit about that experience before you have to nick off?
Yeah, sure. Yeah, Vietnam was a very eye-opening experience. It's apart from it being kind of a regional city that we're in, you know, obviously it's a whole different context to Australia. So yeah, it was just really interesting to get an idea of how culture can affect, you know, obviously my interest is psychology, so how mental distress is manifested in people from different cultures and how that just looks differently to what we're used to in a kind of more Western model. I'm sure there are parallels for the other health professions as well. But yeah, I mean, just seeing a really under-resourced system, but filled with really like fantastic people who are doing an amazing job with on a very, very small budget. And I mean, I feel like I've seen that in some of the rural contexts I've been in here as in Victoria as well, is, you know, underfunding and all those sorts of things, but, you know, really fantastic clinicians and people prepared to go the extra mile. And Alice Springs, I don't know yet because I haven't been there, but I'm very much looking forward to it.
Excellent. Okay, so we'll move on to another question that's come through. What are some of the challenges of doing a rural placement that is different from doing placement in the capital cities? So I know we've got a few people here that have done metro and regional. So if anyone wants to jump in and talk a bit about some of the differences or challenges. Anyone want to tackle that one? No?
I can speak to some of the differences, but from more of a an advantages perspective, I guess.
Yep.
That was my experience. I had a really positive experience on placement. And I felt that there were greater learning opportunities, especially more opportunities to do work on your own than in a metro placement. My metro placement was at the Alfred Hospital. So quite a big service where you kind of almost get lost at times. So it was really lovely when I was on my regional placement that I was more of a real part of the team, and I also got to really take some ownership over the work, you know, carry my own caseload and practice like a colleague. And I guess some of these organisations in regional areas don't necessarily have the same sorts of resources to kind of buffer you with like specific student support beyond, you know, the uni requirements. So so you had sort of more of a sense of being a colleague. And in my team, I was actually the only soon-to-be qualified social worker. So I got a chance to do some things that my colleagues weren't able to do, like providing therapy. So that was really interesting too. And really that sense of contribution in a regional placement, feeling valued, not just an observer, not just a student to get your placement ticked off, really sort of being part of the community. I found that really, really good.
Nice, thank you. Is there anyone else?
Can I just touch on that?
Yeah, I was about to say, Ginny, I know you did Mildura and Melbourne, go for it.
So I really must agree with, sorry, was it Maddie or Hannah who said that? Maddie, I really must agree with what Maddie had said, because it was, so I'm the other way around. I've done mostly placements in like a regional area, and I've gone to Melbourne for a placement. So in comparison, I actually found that, again, as Maddie had said, like you really felt like you're a part of the team, and they allowed you to sort of go on your own and do things as long as it was safe, of course. And you weren't, like, I loved my placement in Melbourne, but you weren't walking on eggshells as much. Because you had the trust of the team around you. And that I can back that up with 2 other students who did a very long placement in Melbourne, and they felt the same. And we actually come home appreciating having our placements in regional areas. And another girl who did a placement in the Northern Territory, and you know, she was the other way. She really appreciated that placement because she really felt like being like even smaller than what we had, that she was really a part of the team and she was a colleague member. So she was able to have that transition from student to health professional.
Thank you. Is there anything else anyone wanted to add to that? Or we can go to the next question that I would like to tackle from our audience. For the graduates, do you think your placement locations helped you choose a job? So Hannah and Maddie, is that something that you wanted to tackle?
I would say it definitely helped me determine my job, because my last placement was at the hospital that I work at now. It was an 8-week placement. It was my final placement, and I hadn't had a proper hospital inpatient acute type ward placement before, and I absolutely loved it. I didn't know if I was going to like it or not, and I had a great experience. By the end of the 8 weeks, I had an independent caseload, so I felt like I was contributing well, and I enjoyed the work that I was doing. So it really pushed me, because I was really eager to get a job in that area when it was available. So I think it definitely, if you like your placement and you have a great experience, it makes you want to do that area again. If you have a negative experience, you tend to avoid it altogether. So that definitely pushed me to try to apply when the next available job came up. And that's why I'm in the sort of position now. Yeah.
Anything you wanted to add, Maddie, or all okay?
Probably I had a different experience, actually. It didn't really push me towards moving up to Shepparton one way or the other. I mean, it really influenced my decision to move regionally and work regionally for sure. But in terms of the specific location, not really. Like, I applied for jobs anywhere and everywhere, and just kind of my decision around what job to go with eventually was kind of more around the sense that I got from the team during my interview, and kind of the position description, and whether that aligned more so than location for me.
All right, we have a question here about feeling. We've talked about relationships already, but it'd be good if some of you can touch on this. We've got a question here from Rebecca about how do you cope with feeling homesick or missing your usual social support? Is there anything anyone want to touch on there about homesickness and how they manage that?
Can I just say a little something on that?
Yeah.
So when I went away for my placement, I guess it's like what other people had said. It was a lot of our online, just talking to friends, and like my study group. I actually called my study group a couple of times, and we were working on an assignment at the time. So, I just called them and told them that I'm actually having a really difficult time, because, during the week whenever I was on placement, it was fine, but it was the downtime that I had. And I really did struggle being away from everyone. And like, I'm already away from my immediate family, like my parents and my siblings. And then being away from my partner and my puppies, because I'm a real big dog person, that made it even harder. So I would just call my family or my partner, and especially my uni friends. They really got me through that. And I even contacted one of my lecturers and I said, I'm loving my placement, but I'm really struggling just being on my own. But having that contact with them really got me through. And I kind of also latched on to another student who was from Bendigo, and we just become friends. And that really helped, having a friend, where we were both missing our families and both sort of afraid of our placement in a way, because we were very unsure. And we just latched on to each other, and that really, really helped. Just making that one friend by your own placement really helped.
Thanks, Ginny. I've got a question from my colleague here that they want me to ask, which I actually think is a really good one that hasn't come through. So I'm going to be a bit selfish and ask it. Is just around tips for preparing to go on a regional placement. Is there anything, advice that you can provide for the students about tips for preparing, just so they can prepare themselves to get the best out of their placement experience? Is there anything anyone wanted to chip in there and add?
The one thing that I would add, just while it's on my mind, is to really look into the scholarships that are available. I know that I didn't when I went on my rural placement, and I actually had somebody from Going Rural Health who happened to be at the hospital that I was at that day, recommend that I go for the scholarship, and I was successful for it, which was really helpful, considering you're not at home, you're not working your usual job hours, just to keep up with your finances. So I feel like there's plenty of scholarships out there, and especially when you're away from your usual home, usual job, usual environment, to go for anything that you can, because it definitely helps.
And I'll just add on to that question, choosing where you stay as well. So if you're if your university doesn't provide accommodation, then definitely make sure that you're looking into where your actual placement is, like where the building is, and then see if there's any local shops or anything around there, and finding a place that is close by so you're not having to travel too much, so that it's a lot more helpful. And maybe even looking into what things are available to do there, what things you can do to sightsee, things to get you excited for that placement, especially because you'll be so far from home.
Yeah, and you build off that. I agree about research the area and what's around, and use your opportunity of being in a rural area to explore that area, because you may never go back to the area. You might go back for work in the future, but you also may not. So whilst you're there, like, get to know the area, see the sites, and yeah, if you're finding it hard to travel back home or back to Melbourne, then you can give yourself stuff to look forward to on the weekends. And if you're going with another student, or there's another student at least nearby, whether it be a town away or within the same place area, you like link up with them and try to link up with them and spend the weekend hanging out, and or even befriend someone, become sort of a bit of a mate with someone on placement. It could even be someone who's a colleague, like someone who works at the hospital or at the service, and like if they're not doing anything, like you might be able to hang out with them for a little bit, and that gives you a bit of a friendship circle whilst you're there, especially if you've gone on a longer placement as well.
Cool, thank you. We've talked a bit about challenges, and you might feel like you've touched on this already, but it's come through as a question, so I really think we should get you to answer it for the ones that are working. What do you like most about working rurally? Maddie and Hannah, is there anything that you want to add there?
I would just add that it's very welcoming. It feels to me like there's a lot of support and time given to students on placements, as well as staff members who are starting in the area. I've had really good support in rural and regional placements and in my new job. So that's one thing that I definitely think is beneficial and has been a good experience.
Can I just touch on that, Beck? Like, being someone that actually lives in Mildura, can I give my perspective on that?
Yeah, of course.
So I'm actually really, really looking forward to starting my grad year, because like Maddie had said, it is very welcoming, but you're also a part of the community. Like, you really get involved in the community, and people seem to be like, well, my experience has been that a lot of people have been very welcoming and very thankful. And I know that you'll get that everywhere, but it's 10 times more. Like, it just seems the appreciation that tends to come across just seems a whole lot more and a whole lot meaningful, especially like if you're helping them where there's a shortage. Like, there's been a couple of shortages in Mildura, and when they get that help where they don't have to travel when they were afraid of having to travel, like, it makes you feel, and it's quite selfish, but it actually makes you feel really, really happy that you were able to help them in that way. And a lot of doctors that on my placements that I've worked with, they've really, really enjoyed their regional and rural placements for that fact. And they're able to really immerse themselves in their skills and just really learn. And it's, you still have a group of students there with you, but instead of like having, 5, like in this inner city, you might have 10, but whereas in a regional hospital, you'll have 5. Just throwing numbers out there.
Thanks, Jen.
Just to add to what Ginny just said, I would have to agree. It's also very personable. So like on a rural and regional placement, everyone in the organisation knows who you are, depending on how big the size of the organisation is. But for my placement experiences, everyone was really easily approachable. I was the only student on my placement for my first placement, so I had a lot of time to be able to have a chat to anyone that I wanted to, or ask anyone, even if it was in a different type of multidisciplinary team, a question. So I felt like that helped get that bread and butter OT skills for a first placement, compared to maybe a more metropolitan placement where you might be one of 25 students who are starting, and there is a lot less time for you in that respect.
I've got something else to add as well.
Yeah, great. Go for it.
So for me, I agree with everything that has been said previously. But I'd also like to mention that I've found that working regionally, relationships look different with clients and their families. I work in child psychiatry, and there's really a sense of having a different sort of conversation with clients and families just through being part of the community. It's more on a human to human kind of level, which I guess breaks down some of the hierarchy that you might feel in metro placements and metro working. And it sort of shifts the power dynamics a bit, where you really feel like the care team isn't just the professionals, it's also the clients, the families, it's the people who are informally involved. So that was a huge shift for me that I really loved. And really, yeah, it's been amazing.
Thank you. All right, so we've got a question here. Even if you end up working in Melbourne or another big city, do you think rural placements would help me be a better health professional? I can see Margaret's nodding. Do you want to have a crack at that first, Margaret?
100%. I think being on rural placement, it gives you so many more skills that you gain here rather than in metro areas. So with my experience here, I've gotten to see a lot of a diverse range of patients that I wouldn't otherwise see in metro placements, such as I've seen heaps of Indigenous patients. I'd say maybe 30% of mine here in Mildura are Indigenous. I've seen heaps of refugee patients, which means I'm using interpreters, which means I'm learning how to communicate not just with the patient, but with the interpreter as well, with the third party through the phone, which is a challenge in itself. So not only are you seeing heaps of different cases, but I would say you're also learning how to solve a lot of different problems on your own. Because you're in a rural area, you don't have all those specialists there who you can refer to straight away. The patients might need to travel to Melbourne to do that, which would cost them a lot of money. So instead, you might need to do some extra treatment, or you might need to think of other ways that you can relieve them of pain or do something to help them out in a rural setting with less resources and less help needed. So I think it really helps with your problem solving, and it really helps with your communication. So yeah, heaps of benefits with rural placement.
Okay.
Sorry, Beck, can I just add something myself to that?
Oh, go for it, Trish.
I just wanted to say that I've had a number of people say to me that they've been in Melbourne in hospital, they were discharged to a hospital or to the community in a rural area, and the people they were working with in Melbourne weren't aware that they were trying to refer them to a service that wasn't available, or trying to, for example, they might be putting them on some sort of dietary requirements that weren't actually always available in the rural area. So it's actually really important that people are aware of the services and some of the constraints that might be in regional and rural areas that might not be there in metro areas. So thinking about discharge plans and what they're going to refer them on to or get them to do when they're going home, because it might not be looking the same as it does in a metro area.
Excellent. Thanks, Trish. I'm going to go on to something that's a bit more logical, and it's about transport. And I think it's a good one to touch on because some of you are far away. So we just talk a little bit about how you got to your placement and how you moved around while you were there. If anyone, maybe Margaret to start, just because you're in Mildura, how'd you get up there?
Yeah. So in Mildura, I've got my car, so I did drive up here, but going back home on the weekends, I do take the train. So PTV is really awesome in Victoria. So it takes similar amount of time, maybe an hour extra. In Bendigo, when I was studying there, I pretty much just took the train and the local buses, or I had a bike as well. So what you'll realize rurally or regionally is that everything is really close by. So like my placement here is only 2 minutes from home. Shopping's only 3-minute drive. So just depends on where you're at. you might be able to get around with a bicycle or public transport.
Anyone else want to shed any light on transport?
For my rural placement with East Wimmera, it was definitely needing to have a license and a car. That was very important because the accommodation that I was staying at was still a good hour away from most locations. So I needed to be able to travel every morning, every night. And then we also would travel with my supervisors in the work cars to go and see the patients in the community. But it was really important. I don't think I would have been able to do that placement unless I had my car and my license. That was very important.
Fantastic. I might just ask one that I've got here, and it's something you can all talk about. You've moved around different areas. What was your favourite placement and why?
I'll say that this one is my favourite placement. So where I am at the moment in Camperdown, this is my third / fourth placement. And I think one of the main reasons is the lifestyle. So it's like, you know, all the things that we've already talked about tonight. So you feel really welcome, like you're a part of the community, like everything's close. You know, I love camping and getting out into nature and stuff. So the area that I'm in is perfect for that because you can just pack up the car and head off for the weekend. But yeah, like the lifestyle is fantastic. And, you know, I've had experience on this placement that I, you know, wouldn't necessarily have in a metro placement. So yeah, it's been my favorite for sure.
Yeah, I'd say probably the current one I'm on now, just because I did really enjoy orthopedics in Shepparton at the main hospital. But I'd say probably this one because it's private practice is quite challenging. You go from being told a diagnosis to having to try to diagnose. And being a smaller town, it was a smaller practice. It was like from day one, here's a uniform. So they've given me the clinic uniform so I'm part of the team and like released out to the public, hey, we've got like a physio student for the next 4 or 5 weeks. And sort of like basically almost like welcoming a new clinician, like I'd graduated. And when I got in day one, it was like, do you feel like you can see a patient tomorrow, like start seeing your own patients? So now like basically within the first week of being here, I was having my own caseload and managing it and practicing time management. So I feel like it's probably my favorite because it's been the most reflective of when I'm a clinician versus when I was in the hospital. It was a very graded exposure, whereas it was just like straight into the deep end and support as I needed. So which I'm expecting would be the case when I graduate.
Anyone else want to shed any light on their favourite placements? No?
I was just saying, so I'm in Mildura at the moment, and despite it being so far from home, I think this is probably one of the best ones I've been to so far. And it's probably because I've grown up in Melbourne, so like, I don't know how many years, for 18 years, 19 years. And just coming here, it's just so beautiful. And there's so many places to explore. It's so close, a few hours from Adelaide. And so we can just go there for a road trip. There's different things to do, heaps of people who are so welcoming and really grateful for the work that you do, especially because it's so far out. Yeah, it's just been a really, really good placement.
Well, of course, I'm happy to hear that because I'm based in Mildura, so I want you to come back here and potentially work as a dentist. Anything else anyone wanted to add to that? Other than that, no. Oh, that's nice to hear, Georgia. I see we've got a question here from a LaTrobe student that's doing a double degree in nursing and midwifery. If we don't have an elective, can I still choose to complete an elective that allows me to do a rural placement? I think you can, but I will have to take that question offline. So perhaps if you can email myself or Libby Simmons, who's also on as a panelist here, I'll get Libby to put our email addresses in the chat and you can get in touch with us directly and we can, Libby's getting in touch, putting her details in there. I think soon, Trish, what do you think? We might wrap it up shortly. I guess I just want to give the panelists an opportunity. If you feel like there's something that you haven't, we've talked quite a bit and covered quite a bit. If there's something that you really want to share that you think is important for students to hear, please pipe up now and share away.
I just wanted to add it, just with the COVID question, I think one of the great advantages during this time where we're so unsure of what's happening is that with rural placements, it's in a rural area. And what we've seen so far in the last year is that a lot of the COVID stuff is happening in Melbourne. So because my placement was in Wodonga last year, I was one of the lucky places, 1 out of 6 who got to keep going on placement. We only stopped for 3 months, but some of my friends who were in Melton, they stopped for about 9 months. So that's a lot of placement that you're missing out on. So when you're in a rural area, the restrictions are a lot less stricter, which allows you to do a lot more for your patients. And it also gives you a higher chance that you'll be on placement next year as well, if anything does happen with COVID. So that's just something else to think about.
The only thing that I would add in just briefly is that if you're still on the fence about doing a rural placement, I know I had friends in my year level who, when they got told that they had received a placement that was hours and hours away from home, they just had no interest in it. It was too far and they were trying to get it swapped or cancelled, to really reconsider it, because I feel like I learned such great transferable skills on my first placement that was very rural, very remote, but I still got such good time and practice with patients to really bump up my communication and my note taking and all that sort of stuff that I wanted to be really good before I went into my final placements. And also I built really good relationships with my supervisors, and these are the people that you're going to have for referees when you finish your jobs, and things like that. So it was a really big benefit for me to make the call and go, you know, stay away from my hometown, travel 2 hours, 1 hour every day, just from the place that I was staying to the locations, to have great referees, have great relationships, and to feel like I was really confident going into my other placements that were closer to home, because I had those transferable skills from my first rural placement, if that makes sense.
That does. And thank you, Hannah. All right, so I might just pass back to Trish, because we want our attendees to do an evaluation before we finish up, and she wants to say a few housekeeping things. So I just really want to thank you all for sharing your stories. It's all well and good for university staff to talk about the experiences, but to hear firsthand from people that have done it really sells at home. And it's really been really nice talking to you, and this is getting me out of the whole dinner, bath and bed and with the kids. So I've really enjoyed it. So thanks very much. I will just pass over to Trish now.
Thanks, Beck. So thank you everybody for participating, especially the panelists who have kindly given up their time to join us. I was just going to ask everyone if, because this is something that we've only done with the group of us for the first time, we really would appreciate your input. So if you could scan the QR code, and there's only 3 or 4 questions, if you could actually complete the evaluation, we'd really appreciate it. The other thing is that this session is being recorded. As I said at the beginning, you will receive a link to the recording so you can actually view it again at a later date. It'll be on our website and it'll also be on YouTube. So please do have a look at it again, pass it on to your friends. You really, really would appreciate if you have a look at it again and pass it on. And that's pretty much a wrap for today. Thank you to everybody who's contributed to putting this session together. If you have any questions, you're more than welcome to contact any of us. Most of you will have had my email address anyway, because I was the main contact for this. So please feel free to pass on any questions. All the rural health schools are actually looking to support students. We want to make sure you have the best experience possible, because we want all of you to come and work for us. So thank you very much. Have a great evening, and hopefully we'll do this again. Thank you.